Thank you. I hope everyone can hear me. Thank you so much for the invitation. And I love the comment, my candid approach to vaccinations, because I'm currently post-call, so I'll be even more candid than usual. And to get to what Mr. Morgan was mentioning, I work in a city hospital at the University of Pennsylvania. I'm an epidemiologist and a gastroenterologist. I'm on the board of Doctors for America as well, and the chair of their COVID committee. But this past week, I have been on service, and every night I am the doctor contact for the transfer center. And so we will get calls transferring people in. And I think it's really important to understand that it's not that we don't want to take care of the COVID patients in these smaller towns and these smaller community hospitals, but we're also getting calls with all kinds of other things because people have continued to have regular health issues in addition to COVID. And it is overwhelming. And so for all those reasons that Mr. Morgan mentioned, the lower vaccination rate, which makes it more likely that these patients are going to be sicker and hospitalized and need more acute care, the age, and just the inability of these community hospitals to provide the services that would be needed for a very sick COVID patient because they become very sick very quickly. It is overwhelming and it's sad, and it's really tough for us to be in the position of having to say no or trying to, it's not a position any of us ever expected to have to be in. So to get to mitigation strategies, so the CDC's current guidelines are to try everything possible to avoid last year. And as a physician, I want to try everything possible to avoid last year. Last year was really hard on healthcare workers and really hard on hospitals and really hard on populations because we had these huge spikes in COVID and COVID cases and hospitalizations and deaths. And the big difference here is that we have vaccines, as we didn't have vaccines before. But the CDC, recognizing that we still have very high community levels, is asking people to please limit indoor gatherings, try and do more of a virtual holiday, go outdoors as much as possible if weather is permitting to have gatherings, and masking up, even masking up in places which would be very populated. So if you're going to a pumpkin patch or you're going to, some kind of a fall gathering, and it's a lot of people, to wear a mask because we know that COVID can spread outdoors in close contact. The truth of the matter is that most people are probably not going to do this because they're tired and they're exhausted and it is the holidays. And we recognize that. And so I always think about, rather than telling people what not to do, how can we get them to what they want to do? How can we get them to the yes as safely as possible? And, the pinnacle here is that you're vaccinated. If you can use the gathering and the holidays to encourage people to get vaccinated, to have them reach out to their doctors if they have questions or concerns, this is the perfect launching pad to open the door to those discussions and tell folks, hey, 'tis the season for vaccination. Let's go and do this so that we can have a really safe holiday. In the absence of that, masking up and having things outdoors, maybe having an indoor gathering doesn't involve food, but having outdoor gatherings that maybe you have food, especially if you're in a warmer climate, that is probably also safer. Even if folks are vaccinated, or if they are not for whatever reason, then rapid testing, and rapid testing before you have that gathering. Remember that it is an imperfect measurement. It's a single point in time, but it's better than nothing else. And if people are going to be getting together, that's probably also the safest measure that folks can have. There was something else and I'm forgetting what it is, so I'd be happy to answer any questions, but I think I really want to, we're approaching this holiday season at a point where we can also get a younger age group vaccinated. And I know that there are a lot of questions and a lot of concerns, but I think that they are also an important piece in this. We want grandchildren to see grandparents. We want families to be able to get together. And so we have the ability now to get our 5 to 11-year-olds, so everybody 5 years and older, vaccinated. And again, to open the door to that conversation and to allow this to be a launching board to getting this vaccinated, because that is the single safest way to have to have a holiday. And in the rural communities, vaccinations are a little bit more challenging, but they're not impossible. And they're definitely, especially for the 5 to 11-year-olds with the new type of vaccine, it's the same vaccine, but it can be refrigerated now for several days. That makes it a lot easier to get that vaccine out. And there are a lot of other strategies that I've talked with Lisa about as well, that we can get vaccines out to folks who may not be close to a place where they get vaccinated. But I think we should be doing everything we can.